I'm John Batchelor. Larry Kudlow, CNBC's Kudlow Reports, is here with me, and Kudlow Radio on the weekend. Affordable Care Act, Healthcare.gov, episode 14 in the melodrama of what went wrong and why within these last hours. The Deputy Chief Information Officer at CMS, that's the machine within the machine at HHS, before Congress, conveying this fact that only 60 to 70% of the exchange exists. The rest is still being worked on. I'll give the quote here. 30% of the federal health insurance marketplace, he actually said 30 to 40%, is still being developed. What part isn't ready yet? The part where you pay your money, the back office functions, the accounting, the check paying in order to buy what you want. It doesn't exist. They're fixing the front end. But what doesn't work now doesn't connect to the money. We got that this afternoon, and I welcome our guest, Ed Lazear. Ed, writing most recently at FoxNews.com, was talking about the president's presentation of why he had to take away all of the individual plans and replace them with nothing, because the site doesn't exist and you can't buy anyway. However, this explanation more than a week ago points to the whole problem of the Affordable Care Act. It's impractical. It doesn't answer the concerns. It doesn't cut costs. It forces the American people to buy something they don't want if they buy it at all. And meanwhile, the government can't get a site done that actually is trustworthy enough to give our money to it. Ed, a very good evening to you. Ed is the Stanford Graduate School of Business professor, as well as he's a fellow at the Hoover Institution. And once upon a time, Ed was in government. That doesn't work much these days. He was chairman of the Council of Economic Advisors in 2006 to 2009, and he tells the story about how he lived 2 miles from the White House when he was in Washington, and he bought a Ford Focus, a compact car, no frills, and that's what he needed. Ed, how does that connect to the president blasting and justifying taking away people's health insurance plans? Good evening to you.
Good evening. Well, pleasure to be with you. And the reason it connects is that the car was perfectly suited to my needs, and the health care plans that the president has deemed as substandard are perfectly suited to many people's needs. In fact, it's worse than that. That's the general point, the philosophical point, but the substantive point, I think, is much more important. It relates to your earlier quote about implementation. In fact, what the president has done is he has ruled out those plans that are actually the most efficient, not the ones that are the least efficient. So what he's doing is he's actually working backwards. It's not affordable care at all. It actually works in the direction of unaffordable care. The reason for it is this. You know, if you think about the healthcare system and why it is that we have very high healthcare costs, it's primarily because of one factor, and that is that the consumer, the patient, even the physician, doesn't bear the cost of his or her decisions. So when we consume healthcare, we bear only a very small fraction of the cost, and as a result, we tend to consume more than is necessary or even prudent in some situations. So, I'll give you one more fact, and then I'll let you jump in. If you compare our healthcare system to that of Switzerland, Switzerland is a good example because it's a rich country like the United States. It has a relatively low level of government as compared with other European countries. Switzerland has about two-thirds the cost of healthcare that we have in the United States. And the main reason for that is that the copay, the proportion that the patient pays, is 30% in Switzerland. In the United States, it's 12%. So what that does is it means that on the margin, the American consumer pays a much smaller fraction of the cost than the Swiss does, and as a result, overuses health care.
Right. I agree. I think that's exactly right. But this Obama fix, doesn't really deal with that.
Well, it not only doesn't deal with it, it goes backwards, because look at what the president is saying. If you go back to what he said, let's think about what we mean by substandard. Substandard plans are those that exclude coverage for maternity care, preventive care, mental health, prescription drug benefits. Now, most of the time when you're thinking about insurance, what you want to do is you want to cover events that are unanticipated, unpredictable, and the kinds of things that you can't afford if they happen. So these are usually the catastrophic events. Now, what the president is doing is he's saying, look, catastrophic plans that cover only situations that are high cost to the individual, they don't meet the standard because they don't cover maternity care, they don't cover preventative care, they don't cover mental health care. Well, a lot of people don't want those things and don't need those things. A single male doesn't care about maternity care. What he's doing is he's doing what John said earlier. The reason he wants people in those plans is because he wants to shift the cost. He wants this to be a way to redistribute resources from some groups to other groups, and that's what it's all about.
Right. This is about redistributing resources from the young healthies to the older and the sicker. And that's the basic point here. And they're in trouble on this because the young healthies are not going to buy the mandated policies that Obamacare wants. So they're going to be short of premiums, and meanwhile, on the other side, insurance companies are going to have to worry about catastrophic claims from the older people who really want to get into this. For them, it's a good deal. For the young people, it's not a good deal. And I don't see how you ever get around that. In fact, today, Ed, there was talk. John Boehner and Senator Rubio both started talking today about the federal government or somebody, Obamacare, putting more money in because of the imbalance, because of the adverse risk factor going on.
Well, that's right. I mean, the way to handle this, look, the problem with people who have very severe chronic kinds of illnesses that are essentially uninsurable, and it's not even uninsurable. The situation is already known. It's not a question of unanticipated. You already know that these people have very high-cost situations and things that we have to deal with. The better way to deal with that is to allow a private market to insure people and then subsidize directly the cost of coverage to a group of poor, and the poor has to be defined very carefully. We're not talking about 300 or 400% of the poverty line, and to those people who end up with an illness that is a very severe illness and is one that they can't afford to cover. That's a much more direct way to do it. It's a much better way to do it. Larry.
Transparent, Ed. It would be transparent. We would all see. I mean, the government would have to make these subsidies to help bolster these risk pools you're describing. But
right.
At least it would be a budget item. We would know how much it is. And, like other safety net items, I don't think the country would be opposed to that, but the country wants to know what's the cost, what's the budget cost, and what's the prescriptive cost, and we'd all be you don't have to create this rigmarole, jerry-built structure, on the way to single payer.
15 seconds, Ed. Go ahead.
To do that.
Well, I agree, Larry, and the other point that just goes on top of that is that the jerry-built structure actually creates more inefficiency than it solves. So it's not only that it transfers resources, but that it actually induces
Ed
the wrong
Lazear
incentive.
of the Hoover Institution, Larry Kudlow of Kudlow Reports. Ed and his Ford Focus, adequate for working for the government. I'm John Batchelor.